Hey everyone, Dr. Mark Fundino here with Davidson Chiropractic. Hope you're doing well. If you're looking at this video, you might have just read the email I sent out to you regarding opioids and who do you know that might be taking opioids or who has not been on opioids. Like we're talking about drugs such as OxyContin, Vicodin, Tramadol. These are all drugs that actually are responsible for 130 deaths every day. Usually by accidental overdose. They also cause problems taken in the right manner. They increase your chance of heart-related death by 400%. A single script over the course of 30 days has been found to be that risky. Many of the people I work with have chronic pain. They've been in pain for greater than 3 months, maybe 6 months, maybe even years. If you haven't gotten any relief from different types of therapies or medical treatment, such as physical therapy, chiropractic, orthopedic type of solutions, then you might want to look into some other avenues to help reduce your chronic pain or inflammation. One of those being looking at your sleep patterns. Are you getting more than 6 hours of sleep and not, more than 6, but not over 9? So somewhere in that window is kind of like the sweet spot as far as where it's helping to provide restorative type sleep. How are you managing your stress levels? I know it's difficult to do in today's day and age of being busy with kids, with taking care of maybe some relatives or parents that are aging, but definitely focusing on your mental health is important. Exercise. Are you getting out 30 minutes to an hour, at least 5 days a week, whether you're taking a walk, engage in some type of jogging, bicycling, swimming, some type of aerobic fitness, and maybe you're even adding some weight training to help maintain lean body mass as we all age. These are all good for your health and actually reducing inflammation and therefore pain. Also your diet. This is a big one we're going to touch upon today. Are you adopting an anti-inflammatory diet? Now, I'm not saying everybody has to do this type of diet, but if you haven't gotten relief from chronic pain using manual therapies or other medications, it's time to look at at your body from within. You're probably running high rates of inflammation for whatever reason. So now is the time to adopt an anti-inflammatory diet, focusing on mostly lean meats, fish if you can. Definitely would push the salmon, those types of fish, eggs. Getting twice as many vegetables, like green vegetables like broccoli, spinach, Brussels sprouts, and about half as many fruits as you would vegetables. Eating the whole fruit, apples, there's some other good pears, things of that nature. Then eating some some seeds or nuts, getting good fats like olive oil, coconut oil, and then just a little bit of, actually no refined, I would stay away from the refined sugars, artificial sweeteners, grains like breads, pastas, cereals, things of that nature. Maybe a few sweet potatoes would be good. Different types of squashes would be good, but definitely kind of changing your diet to reflect those types of foods to reduce inflammation and swelling. Now, supplements are what they are. They're called supplements. They're not meant to substitute a poor diet. So some supplements that are good for chronic pain and inflammation are turmeric, ginger, boswellia, magnesium for muscle health. What else? We got vitamin D, probiotics, coenzyme Q10. These are all good supplements that are going to help reduce inflammation. For turmeric, boswellia, magnesium, you can take anywhere from 1 to 2,000 milligrams a day. Vitamin D, anywhere from 2 to 10,000 international units. But we would like to get some blood looked at to make sure you're not going to get either too little or too much. So definitely it's good to get your vitamin D levels checked at times. Let's see, what else do we want to take? Magnesium, you're going to take anywhere from 400 to 1,000 milligrams a day to help with those, keep those muscles relaxed and help with swelling and inflammation. So those are some tips you can use to help combat chronic pain. For those of you that have been suffering or know friends or relatives that have had chronic pain, or you know people that are on opioids for chronic pain, I do feel for you. people don't even realize that they're abusing it sometimes. They might be taking friends' medication, a family member's medication, leftover medication that they had from a surgery 10 years ago. I really get nervous with taking any type of medication, let alone opioid, especially for long-term use. As you guys may or may not know, I had a ruptured bicep tendon about 8 months ago. I was prescribed some medication to have for kind of that breakthrough pain. Admittedly, I was allowed to take, I think, 1 to 2 tablets every 4 to 6 hours. I think I took a half of 1 tablet. I did that maybe 4 times, so I took a total of maybe 2 total tablets. And even in those 2 tablets I took over a course of 24 hours, I did not feel very good. Did it help with the pain slightly? Yeah, a little bit. And it's different than somebody who's had chronic pain. So by no means am I trying to compare myself to somebody who's been dealing with chronic pain, but I know what I got after that. I had 5 days of constipation. What they say, those commercials you see are true. And coming off of it, even after just like 1 day, my brain was like in a fog. I had a headache. And so I can't imagine somebody's been building doses up over a long period of time, and what it does to their body and what potentially it can do. Like I said earlier in this video, one 30-day script has been shown to increase the likelihood of death by over 400%. And somebody who's taken an opioid will transition to heroin at some point. So it's nothing to play around with. It's not just people think, oh, it's not my type of disease or problem. It's somewhere way up in the mountains. It's not hitting home, but I tell you, it's here and it's prevalent with our very educated population too. So try those tips and tricks for you or for anybody you know. If you have questions regarding certain dosages and you want to contact me, you can get me by email, davidsoncairo@yahoo.com, and I'll be happy to answer any questions. For now, have a great day. We'll talk to you soon.